CDC finally warns that airborne coronavirus can spread more than 6 feet in fine aerosols. I could have swore last week that I heard something where they were saying that in terms of social distancing, whether it was 6 feet or 60 feet, there was no real difference. Now, granted, that's a little different, and before I came to shoot this, I just heard on the news, the winter surge! If we don't get fully vaccinated, the warning of the winter surge! A couple seasons ahead of this stuff, getting a little fear porn. CDC updated its guidance on how the virus spreads to include transmission through fine particles that travel more than 6 feet through the air, or aerosols. Experts have warned for months that it is likely to spread this way, not just through close contact and droplets. It comes after the CDC said that fully vaccinated people can stop wearing masks outside, but amid confusion over how to tell who is and isn't vaccinated. We need a mark. We need some kind of marking to know, maybe a tattoo on my neck, since I don't have it. A big scarlet letter of sorts. Previously, the CDC warned that the CV spread primarily through close contact, coughs, and sneezes, not through what is known as airborne transmission. Viruses that are airborne are tiny enough to travel farther distances, such as aerosols, rather than large droplets. Evidence has mounted for months that the CV travels this way, but the CDC largely punted on the issue, saying it was still assessing the data until now. The agency's advice also continues to move away from warning about the risk of contacting the virus from surfaces, though the new guidance does acknowledge their potential to become contaminated. Lysol, pissed off at this news. Remember, Lysol was touting their sprays as being able, and not just them, but other bleach wipes and things like that, able to clean the surfaces. Oh, we can't touch the surfaces. Don't touch the surface. If you touch the surface and you go right to your eyeball or your mouth, the corona can go right through your eyeball. We've come a long way in a year, but yet it seems like we're still going in circles, doesn't it? Photo here. It looks like we've got a video. New research shows just how sneeze droplets can travel. Let's watch some of this video. What I don't get is this is just some kind of animation, obviously. Because look, the guy's mouth didn't even move. The people's mouths aren't even moving. It's just some computer animation. Come on, I was hoping they'd show me an actual sneeze happening, like you just busting out a sneeze right now, just the stuff going everywhere. They do say here there's a little bit of a scale here, 43 inches it says. Oh, we got another one. 6 to 7 meters, 23 to 26 feet. What else? That's it. The CDC acknowledged back in October that there was a possibility of airborne transmission, but downplayed this risk, saying that the risk of transmission was low at distances greater than 6 feet, although such cases had been documented. Have they? And this is something I've always questioned is, how do you know? I know that there's certain times where we could know, say like somebody in your household has it and then you get it, but say I'm just randomly out at a supermarket somewhere or at a dining establishment and somebody, actually let's not do that because people are supposed to be wearing masks in those places in a majority of states. Let's say I'm just walking around the street of a downtown and people aren't wearing masks and 5 seconds before I walk through an area somebody sneezes. I come around the corner, I walk right into that fine mist, I get some of it in my body. How do they know? How would I even know where I got this from? Has this been observed? Has it been witnessed? I'm just wondering how it's been documented. In these instances, it would seem totally random, totally unlucky in a way that you would get this. It's not like they're there with a video camera or some camera was on the street and witnessed somebody sneeze. 2 seconds later, I come around the corner, and then a week later, I have it. So that's all I'm wondering is how these things were actually documented. Indoor settings among close contacts remain the primary hotbed for the spread of the CV, which is what I was saying. I guess that makes sense if you have some kind of knowledge that within the house that some idiot was sneezing and not covering it up, and then later on somebody got it. But again, you'd have to see it on camera to be able to tie it to a specific event, right? But the CDC's new guidance at last acknowledges how the virus can travel long distances in a fine mist and to be inhaled. With plenty of anecdotal stories of people mysteriously developing the 19 without any known close contacts being affected, aerosol transmission seemed like it would inevitably be recognized as a mode of spread. The CDC has finally removed language that the virus spreads with close contact. Number of new infections per day, they're just throwing that in there. Brutal. Okay, so it looks like we're coming down, a little bit of a peak, coming down again. What is this here? Number of infections per day, still under, what is that, 50,000? Under 50, maybe about 40. Number of U.S. deaths per day, looks like they're down to about 500, 550-ish. CDC's updates also came at a poignant moment, a week after it advised that fully vaccinated people can safely go without a mask for just about any outdoor activity, regardless of the vaccination status of those around them, unless they are in a crowd. However, the agency still says that unvaccinated people need to continue to wear masks outdoors unless they are exercising with members of their own household or with fully vaccinated friends and family. It also said that fully vaccinated people can ditch their masks during small indoor gatherings with other fully vaccinated people. It's the whole, oh no, they're saying indoor gatherings, outdoor as well. You can have that barbecue now with maybe like 3 other people from your immediate household, according to Uncle Joe. Maybe by July 4th you can have a barbecue. Which the Bidens as well as Harris were pictured doing for the first time in the past 2 weeks. The change was long anticipated and welcome, but also left confusion in its wake because the U.S. does not require people proof of vaccination, meaning there's no way to tell who and who isn't vaccinated. Like any form of transmission, aerosol transmission is less likely to occur outdoors than in. What? What? But what's this whole article been talking about? But the newly articulated warnings about the ability of the virus to spread further than 6 feet in fine particles comes at a time when more Americans, vaccinated or unvaccinated, are going maskless. Percentage of the population vaccinated so far, the U.S. total 1+ dose is at 45%. States that are redder are states that have been more vaccinated or have individuals that have been more vaccinated. Northeast, California, as you see, a little bit more red. Some of the west here through the Midwest actually pretty red. A lot of the south lagging behind. CDC has now caught up with the latest scientific evidence, and they've gotten rid of some old problematic terms and thinking about how transmission occurs. Virginia Tech aerosol expert Lindsay Marr told the New York Times, "I'm so glad they remind us that the scientists behind these measures have barely researched them before implementing. For example, there's over 46,000 face masks peer-reviewed studies that conclude that they cannot prevent respiratory viruses. But that doesn't stop people from hopelessly believing. If you have any desire to protect your health, do your own research, and you'd be amazed at what you can learn." Exactly. Biden wears a mask outside and on Zoom calls, but not with the elderly Carters. What planet have they been on? This has always been accepted, proven numerous times. Social distanced for. Who is behind this drivel reporting? Blah, 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 yawn. Didn't we already know this 9 months ago? They defined safe distancing at 6 feet apart. Enough already, go away. Where did this virus come from? Why can't the CDC tell us that? Until then, they can KMA, which is kiss my grits. Many scientists saying this a year and a half ago, which is true, which is what the first comment pointed out. So much contradiction, so much confusion, lack of information, so much politicization, and that's why we have the problems that we do. It makes you wonder how these individuals get in such high-level positions to begin with. Individuals that would blatantly lie, telling us not to wear masks so we can preserve them for those on the front lines. How many deaths did that cause? It's that kind of stuff where you can't get some kind of consensus within the medical community, everybody going their own way. The science has to be believable. How come we can't come to a consensus on this? I'm not going to act like I'm hating on all people because I don't have that kind of background. But that lack of an ability to come to a consensus on some basic things that seem like we should be able to have some kind of agreement on. That's what causes a lot of the problems with people in society, in my belief. Well, thanks for watching, everyone. Be well. I've got to go outside and jog right now, and I won't be wearing a mask because wearing a mask while exercising is dumb. And exercising and getting a lot of sun is good. Builds up my immunity. Thanks for watching, everyone. Take care. Be well. Get out and get some exercise yourself. Get some sun. Be well, everyone.